So it's very frequent that couples will have excess embryos cryopreserved. Ideally, we would love for them to use them, but only about half of the patients will. So then the other half of the patients have to make a decision. One of the simple decisions is to keep them stored, which is kind of like a non-decision. But eventually they'll have to make some type of decision. Use them, perhaps donate them to science if we can find some place that will take them. Donate them to the laboratory for quality assurance and training. But of course also with the option of embryo donation is donating to patients in need. We prefer that they not discard them, but that is an option in many programs. And we really don't want them to abandon them, but I suppose that is one decision too. So when one has excess cryopreserved embryos and trying to decide what to do with them, the option of donating to patients in need to other individuals, that's challenging. That's a tough decision to make. Think about it. It would be that somebody else would be essentially raising potentially your genetic child there. So it is a difficult decision. And somewhere in the neighborhood, depending on the study, anywhere from 2 to 20% of the decisions will be to donate to patients in need. But it is a hard decision because people just aren't comfortable with the process. When patients are faced with this decision, we call it a final disposition decision of the cryopreserved embryos. In order to perhaps make embryo donation more appealing, we need to make sure that the embryo donors feel comfortable and feel safe. And we do that in a number of ways. Number one is, at least in our program, for example, the patients still own the embryos. So if something catastrophic happened to their children, they would be able to get their embryos back. Now that's unusual for an embryo donation program, but it works really, really well. It makes them feel safe and comfortable about donating. In addition, let's say we have a lesbian couple that have excess cryopreserved embryos. They may want to donate to another lesbian couple. And so those are called conditional donation stipulations. So we want to allow the donors to decide what types of patients might receive their embryos. And then the other options of the type of donation, whether there is an identity disclosure program, there's a whole bunch of other options that help make these patients feel comfortable and feel safe. But that's the key. They need to be okay about the process.